Okay, welcome back. I just got a tweet from a viewer asking, what about if your urine that is clear, but it smells bad? What does that mean?
Sometimes the diet can do it. So if you have asparagus, you may have that odor. But also a lot of times it could be urinary tract infection. You may still have a clear urine, but have some bacteria. So we can test it and treat it. It's very easy.
All right.
Thank you.
Well, you know, people worry about that. Now time for our weekly segment, Should I Worry? It's about everything that worries us. And this has to do with catheters. One viewer wrote us, quote, I have a Foley catheter that I sometimes wear, and I'm worried about infections. Dr. Samadi, what about catheters?
So this is a sample of a catheter that we use all the time in the office, and this is basically to drain the bladder. A lot of times men come with enlarged prostate. They may not be able to urinate. So the reason why we put a catheter, it is either the bladder not functioning well, or there's obstruction with the prostate, and certainly in women sometimes we see this. What holds this catheter inside the bladder is a balloon over here, and I'm scaring Arthel, she's not going to look, but this is how it stays there, and it can come out. If you leave this for a long time, you can get urinary tract infection. I rather basically teach the patient how to do what we call a self-catheterization. We teach the patient to put them in, put them out. You don't want this catheter to stay there for a long time because 80% of nosocomial or infections in the hospital is from urinary tract infections.
So, Mark, what do you tell your patients?
Commercials, though, Dr. Siegel, for you can order the catheters on the television commercials. So I still don't. I'm not clear on. First of all, are those effective? The ones you can order,
Same
they're disposable, and really, I still don't get it. Why do people have to wear them aside from the enlarged prostate? What are other reasons?
Well, the number one reason is post-operative, after surgery or during surgery. If a urologist is actually operating on the prostate or another urological procedure, you might end up with a Foley or really any anesthesia.
Yeah, that's right.
But the main issue is to keep them from getting infected. And how do you do that? You do that by everybody has to wash their hands. Everybody has to wear gloves at all times. You have to keep the bag below where the actual catheter is so it's draining all the time. Don't start taking it apart. Don't start separating, as you're emptying it, don't start separating where the catheter is from the bag, because that introduces bacteria. You might want to use something like bacitracin on it. You want to keep it very clean when you insert it so that you're not inserting a bacteria. Once the bacteria gets on there, it's going to track up into the bladder and start leading to an infection.
And the longer it stays, as you mentioned, the longer the catheter stays, the worse the infection is going to get. So you want to try to remove it the first opportunity you get. And if they can't tolerate it, then you teach them how to do it. On nursing home patients, what we do is we put in a suprapubic tube. It's a tube that goes over the abdomen into the bladder so they don't have this. And this can actually cause sepsis and can put people in the ICU and can kill them. So limited number of catheter when it's necessary.
Only use it when necessary. Use sterile techniques at all times and clean between inserting. Really important.
All right, thank you.
Here, touch it.
That's you.